Here with us now is Dr. Celine Gounder, the editor-at-large for public health at KFF Health News and an infectious disease specialist. I'll note she spent 2 months working in West Africa during the 2014 and 2016 Ebola outbreak. Doctor, thanks so much for joining us. Let's pick up where we just left off with Britt, and she reported a bit on how this is an unusual strain, right? Talk to us more about what makes this strain particularly dangerous and different from others.
So this is Bundibugyo. What makes us different, it's 40% different genetically speaking from the kind of Ebola that we saw, the species of Ebola that we saw in West Africa. Unlike that species, we have no vaccines, we have no specific treatments. You're really just looking at supportive care. So things like IV fluids, that's really a lot of the mainstay is trying to rehydrate people. We are also dealing, as Dr. Ramoyne said, with a very difficult situation as compared to that last outbreak. That last outbreak was the biggest outbreak we'd ever seen of Ebola. People probably still remember the headlines. So not only are we dealing with Ebola in urban settings, migrant workers with cross-border spread, we're also dealing with armed militia groups in the area. So that makes it more difficult for healthcare workers to get in there, refugee camps. The size of this outbreak would indicate that this has been festering for months. You've also had the collapse of the local healthcare system, in part related to the armed militants, but also related to the dismantling of USAID. They have shortages of personal protective equipment, which means that the risk to healthcare workers is going to be that much higher, more likely to get infected. So there's a whole lot of factors here working against us.
I mean, to reach this qualification or declaration of a world health emergency, what does that mean? And have we seen an effective global response to these types of declarations in the past?
Well, yes, it does help mobilize resources generally to make a declaration like this. And for the Director General of the World Health Organization to make this declaration even before a meeting to discuss whether to do this or not speaks to the urgency of the situation and to how large this outbreak already is.
The first cases were reported in Mongwalu, a mining town, a health zone in the DRC, and the World Health Organization has now confirmed cases in Uganda as well. How big is this threat to areas beyond these two countries?
Well, there's probably been wider spread than we even realize. If you go back and look at early signals, there probably were signals going back to March. And so that means that a lot of people have been exposed by this point, in particular healthcare workers. That's where we tend to see a lot of the early infections. And then also family members who might be caring for sick people at home, burials and the rites around burials are another major risk factor. So we're probably just seeing the tip of the iceberg. Now, in terms of spread elsewhere, we've already seen spread to Uganda. We're very concerned about spread to South Sudan, where you have large refugee populations. Kampala, which is the capital of Uganda, is where those couple cases were seen in Uganda. And that's a major travel hub for Southern Africa.
The U.S. Agency for International Development, or USAID, has played a big role in containing the previous Ebola outbreaks like 2014 to 2016, which you were a big part of as well. But last year, the Trump administration shuttered USAID. What's the impact of that move, especially as it relates to this new outbreak?
Yeah, so USAID funds the boots on the ground response. So they fund the people, the protective equipment, the supplies that you need for a response like this. And even before this outbreak, I spoke to a researcher over the weekend who'd been looking at what have been the impacts of USAID pulling out on health in the region. It's estimated that over 300,000 people have died in this region as a result. So things like maternal death, tuberculosis, malaria, and so on. And so, we were already seeing impacts even before this. Now you're not going to have the people who need to be responding. Their health system is collapsing even before this. And their pharmaceutical and the supply chain is also in big trouble. So it's going to be very difficult to respond as quickly as we would like.
Quickly, if you will, how concerned should Americans be?
Well, to put this in perspective, so when I heard about COVID in late 2019, early 2020, I was terrified. Hantavirus, I am concerned for the people who are on the cruise ship. I am not concerned about it, an epidemic or pandemic. This has me very concerned.
And why is that?
Well, we've already seen the fact that this Ebola outbreak is larger at the time of detection than is normally the case. So it's been brewing for a while. I think this has the potential to be bigger than that 2014, 2016 epidemic in West Africa. I think based on the fact that it's all the same risk factors plus more, plus the U.S. not being able to respond to help contain this in the way it used to be, I think this is really very, very concerning.
We will be following closely. Dr. Celine Gounder, thank you.